Everyone has expectations for their children, what they want them to be and what the future is going to hold. And Emma challenged that for us.
She had surgery when she was a little over 2 to remove that part of the brain that was pretty damaged.
I have epilepsy. I hate it.
There are many different kinds of seizures.
More frequent seizures, more disabling seizures.
There's a wide spectrum of disease.
Epilepsy is more than one disease.
It's hundreds of individual disorders.
No two people have exactly the same kind of epilepsy.
And many different causes for epilepsy.
Epilepsy is a disease that affects 1 in 26.
Families with epilepsy live in constant fear.
Every minute, every day.
People, they just all start stealing.
When we first found out that we were pregnant with Vivian, we were on a trip in Paris. We were there for about a week, and Lisa started to kind of feel a little out of sorts.
Everything was making me sick.
So the last day of the trip, she went out and got a pregnancy test, and it was a little bit confusing because it was a French pregnancy test. I remember us both kind of looking at it and being like, I think you might be pregnant.
We definitely had to Google the results.
It was just a really beautiful way to end this wonderful trip together.
She had a brain bleed from the traumatic birth, which would eventually lead to, hydrocephalus, which would then lead to her seizures. And that, once that started happening, it was just living in fear for the next one.
You feel real helpless.
I can't. She's just getting worse and worse. These seizures are getting worse and worse. I'm just so desperate for relief for her. She's in pain. She loses her language. It's just killing me.
Epilepsy is a disorder of electrically excitable tissue, brain tissue.
That electricity is controlled by proteins called ion channels.
Our neurons have a lot of different kinds of channels and receptors, and each one of them is really critical for brain function.
When those channels don't function well, that can result in seizures and epilepsy.
Zayn is a patient who was diagnosed with Dravet Syndrome when he was about 3 years old, after he had had multiple convulsive seizures requiring hospitalization and rescue medications many, many times.
So, we're talking about Zayn Tello.
Yeah, we are. When I was asked to come over and meet his mom and Zayn, when he got the first infusion of our drug that we developed with Stoke Therapeutics, that was, for me, for a basic scientist, that was worth the whole career. that I could see something that we had developed all the way from cloning a gene and then to develop something that actually went into this sweet little 9-year-old boy and see him improve was just worth my whole life.
This is a really exciting time.
A really exciting
Very
time.
exciting time.
New things have opened up.
New discoveries.
Next-gen sequencing.
New potential treatments.
The ketogenic diet.
New approaches.
Explosion of gene discovery.
The advances in epilepsy surgery. Game-changing.
We have gone from knowledge for knowledge's sake to there are patients waiting.
We are in the prime time right now to have transformative change in epilepsy.
The sense of collaboration is incredible.
I like to think of treating epilepsy as a team sport.
If you want to go fast, go alone. If you want to go far, go with a team.
We are among the very most collaborative institutions in the world.
We need to invest in people who can look toward the future, who can bring the tools that we have right now at our disposal to this problem of epilepsy and get us to many more treatments, many more cures, and much more healing for the families who are affected by this condition.
She was just a sweet little fighter. We couldn't save her, but I think through the process of being in the hospital as much as we were and seeing other families, in the ICU and I couldn't sit back and do nothing.
She's not here anymore. She doesn't get to continue her fight. We really owe it to her and to ourselves to fight for her. And so every little victory and every little discovery and research that's going to lead to more it's healing for us. It's a win for us. It's a win for Vivian.
Not only am I fighting for Vivian, but I'm fighting for my friends' children who might have a seizure or, a relative or anyone else who might, be faced with that.
It's a big part of our job to educate the next generation. There's a shortage. I get calls from programs all over the country saying, hey, do you have someone that we could recruit that's young that will help build our program?
It's a tragedy that we're losing these wonderful minds because, one, they don't see how they're going to pay back their loans. They don't see the way forward financially. So we need fellowships to be able to pay and compensate these brilliant young minds.
We're looking to attract more people to the field of epilepsy.
This is one of my favorite things. This little blue brain pin was given to me by a teenager who has difficult to control epilepsy. And she gave it to me so I would remember her. Every time I see her, she looks at me and says, "Shell Haas, you have my pin?"
She's quirky, she's brave.
Yeah.
Like even in the hardest situations, like for example, we were in the hospital for a couple weeks, but she always was able to say funny things and keep it light. I feel like she was the one who got us through the hospitalization, even though we thought we were there, for her.
Yeah.
But that's just Emma. That's how she's always been. She's been like that since she was a baby and first started talking, and no different today, for sure.